No path to recovery is a straight line, but when you're ready, it leads you to Sierra Tucson, treating mind, body, and spirit with the most advanced clinical and integrative therapies, led by a world-class team of doctors and therapists who have made Sierra Tucson the leader in addiction and behavioral health treatment for 30 years. Step out of your routine, focus on recovery, and miracles can happen. Sierra Tucson, where change begins.
For so many, we know the name Sierra Tucson, but for a lot of us, we may not be familiar with exactly what you provide. So I just wanted to introduce the doctor, Dr. Bennett Davis, who is joining me now, representing Sierra Tucson, and also talking about pain, chronic pain. But let's go through the list of some of the things that you address at Sierra Tucson.
Well, Sierra Tucson has been around for a while, and they have programs for mood disorders. Of course, they treat addiction there. Programs for trauma, including first responders, military, that sort of thing. And they have a pain program as well, which is what I run.
And you're here to talk about pain. And you say that an integrated model is really key in addressing pain in somebody?
Absolutely,
okay.
Yes.
So how is that? How does that come about?
Well, so if you ask yourself what chronic pain is, we're not talking about appendicitis here. We're talking about something that's been there for a while.
Right.
Someone that's had pain for 6 months or more and they're just not doing well and not getting better. Sometimes that's from a painful thing, a tissue or something like that, arthritis. But what we're discovering more and more is a lot of times chronic pain comes from in the nervous system. So I can give you an example of that.
Okay.
Imagine someone who's lost a leg and they have phantom limb pain. They have no foot, but the foot hurts.
You still feel that, right?
So you can't treat the foot, you can't treat the tissue because there's no foot. So where's that coming from? When I ask people that, they'll do this. They'll
of course,
point to their head.
That's my immediate reaction.
It's like, no, it's not in their head either. So where's that coming from? In the nervous system. So if you're putting together a program to treat the tissue and the nervous system and all the effects that chronic pain can have, like depression, anxiety, you've got to cover all the bases, the physical side, which is what I do, and also behavioral health. People have the expertise to bring on board to treat a lot of the stuff with the nervous system and anxiety and depression. Got to treat it all at once.
Okay.
Then support them with physical therapy, yoga, acupuncture, things like that.
Can't do one without the other.
You can't. So in private practice, we'd try to do that, and we'd have people do one at a time. And we had good results, but coming to Sierra Tucson, we see much better results because we're getting it all done at once and fast.
Right. You're really immersed in this field of medical expertise, right? And you see the changes happen, I think, a lot more quickly when you're in an environment like that. Plus, we have to mention that it's a very relaxing environment at the same time.
It is.
It is.
It's very, very nice.
Very nice. So, okay, when you're talking about people who are suffering from traumatic experiences at Sierra Tucson, what are you talking about?
So I was kind of leading into that. I gave the example of phantom limb pain.
Right.
That's trauma directly, physically to the nerves if you lose a limb. But traumatic experiences, things that are life-threatening that people survive, also change the nervous system. So it's a hard thing to sometimes for people to get their heads around. But experiencing something that's traumatic changes our nervous system. Sometimes that change leads to chronic pain. Without going into all the details, sometimes chronic pain is one of the effects of that. So what would be the right treatment for that type of problem? Treating trauma. Even though we're really treating the pain, you know, the person comes for saying, I need my pain treated, that's what makes the pain better, is treating the trauma. Oftentimes whatever is traumatic leads to a physical problem as well. So it could be from a surgery even, or medical treatment. Cancer treatment's traumatic if you think about it.
Right.
So we see people who've had serious medical illnesses, injuries, that sort of thing, and we treat the physical as well as the trauma.
So another part of your body really is kind of compensating from something else that it's lacking.
Right.
Okay. And
that's right.
So, and we were talking about the beauty of Sierra Tucson and the relaxing part of it, and you being a part of it, you've experienced that. But in terms of experiencing what it's like to see somebody heal or family members see that person heal, what's that like personally for you?
That's what gets me getting up in the morning and making the drive to Sierra Tucson and sticking with it, because for those of us in healthcare, that's what we do it for. You know, I just got an email from somebody that graduated the program probably 3 or 4 months ago, and she's talking about how she's back to work and she's got her life back. And you know, you just sit back, you take a breath and go, that's what I do this for.
Yeah, and I'm sure that that's what you would recommend to people who are watching at home. If they're thinking about doing this, what would you say?
Well, if they're thinking about doing it, I'd say talk to your primary care provider.
Okay.
And they might go, I don't know, because they're not aware of what sort of programs are out there beyond what they have in their referral book. But start by talking to your primary care provider. We want to work with people's medical providers, whoever that is. It could be a doctor, a nurse practitioner, a naturopathic doctor, whatever. Start talking to people and find out what resources they would recommend. But think about calling Sierra Tucson, because our admissions team can guide people as well. We actually have people in the Tucson area, one in particular, who's dedicated to helping people navigate that question. What do I do next?
And doing it all at once, which I know you say is so important. Doctor, thanks so much for being here today, giving us an education, especially sharing the wonderful parts of Sierra Tucson. The Sierra Tucson admissions team is available to answer any of your questions to help you make the best decision for you. They work with most insurance companies as well. So if you'd like to learn more, you can call them right now at 1-800-842-4487.